Namaste. We are talking about social protection for home-based worker. Home-based worker are workers who stay at their home and work for remuneration, work for money, and there are different types of home-based workers. Some are piece rate home-based worker, they produce goods and services, and some are own account home-based worker. They bring their own raw materials, where piece rate workers have orders and the raw materials from the employer or his agent, and then there are contributing family members. These are special kind of workers because of their of the production they do. They bear the cost of the production. They stay at their home and they are very hard to reach and unite. This pandemic which came across clearly visualized that there is a very much discrimination for this home-based worker or the informal sector workers and the formal sector workers. It also clearly impacted most the home-based worker because they are on the lowest tier of the economic ladder. So as we know, effective social protection system are crucial for safeguarding the informal workers when crisis happen or when they are regularly working, because they can't work sometime, they need maternity leave, they need pensions, they need social insurance, and they need health insurance to look after them. We home-based workers not asking social protection in a welfare approach. It's our right. We are asking for our rights. We need worker rights and we are workers. So it's also social equity because we are workers but not recognized as workers. So we want that home-based workers are included in each country's social protection and programs. And there are, as we know, this social protection will guarantee minimum level, which will guarantee the minimum level of income and dignity for managing risks and building resilience. And then they should be designed for the specific needs and specific capacity of the home-based workers, and special social assistance should be designed when there is pandemic, there is unnatural events and unpredicted impact. So there are, as we know, there are different kind of social protection choices, like the social assistance where cash transfers, ration supplies and access to support services during the time of crisis, and child care allowance. There are social services which should be accessible and affordable and quality health care, testing and vaccine. As you know, it's out of reach of the home-based worker, the poorest segment of the society, for the testing and the vaccines. So we also need them. And within the social services, affordable and quality child care services are also needed. Access to support services during time of crisis for the mental and social welfare, to cope up with the natural disaster impact, coping with social ills like violence, sexual harassment, workplace harassment should also be there in the packages and programs. Assistance. A home-based worker use our home as a workplace, so the workplace should be well ventilated, should have light, should have adequate toilets, water connections, and right. The social service also need to ensure that decent work conditions are met, because of the undecent work condition we always suffer. We are not accepted by the employer or the government, so we need health and accidental insurance, maternity benefit and protection, unemployment insurance, pensions and coverage in provident fund. So this should be covered through the policy act, guidelines and social mechanisms should be ensured that we get them. But there is not happening because of the different obstacles, like the lack of identification and acceptance of home-based worker as a form of informal worker or as a form of workers. So lack of law constitution is there, high cost of participation. We don't need to pay high level of taxes for the contributory based insurance policies. So there is no different. We are different IPs rate, own account, whatever, family contributor. So it creates hassle when we develop when the policy is developed. So that's another hindrance, and we ourselves don't know where to go, where to assess, and what is there. So that knowledge gap is another hindrance. Low income, and we are neither very ultra poor, neither we are rich. So we are in the middle class, very lower middle class, or the higher poverty class. So that also clears a hindrance. Assessing to the social protection schemes that is very designed for the very ultra poor and very vulnerable. So we are migrated. So another hindrance on the social protection, accessibility of home-based worker to social protection is duplication and not coordinated social protection programs which are scattered and which we cannot assess as the worker. We can assess it as a single woman, we can assess it as disabled, but not as a home-based worker. So I think these overcoming this obstacle and listening to the government, if the government is ready to listen. There is also the government also thinks that social protection, giving social protection to home-based worker will create a lot of financial burden for themselves, and they don't know where to start up with. So we need also to ensure them that they know where to take small steps and give us social protection. But in the long run, I think we'll overcome this obstacle and we'll definitely get our social protection. Thank you.